So today we are going to discuss leukopenia. What is leukopenia? If the WBC count or TLC is less than 4500 per microliter, it is leukopenia. Now the problem with leukopenia is that leukopenia results in increased chances of developing different type of infections in the human body, and these infections can produce some symptoms. So these symptoms are because of the diseases caused due to leukopenia. And sometimes there are diseases which can produce leukopenia themselves. So a complete understanding of the patient's history, physical examination should be used to interpret the leukopenia. Now the various symptoms which can be seen in patients who got leukopenia, this may be fever, there may be chills, sweating, sore throat, cough or shortness of breath, skin lesions, non-healing wounds, oral ulcers and dysuria. So you can see these symptoms which are because of infections, they are caused by leukopenia. Sometimes some of these infections, they cause leukopenia, so that is you have to assess that the reason is leukopenia or leukopenia is the result of the disease. Now leukopenia can be because of production failure. The bone marrow fails to produce enough leukocytes. So that may be aplastic anemia, myelodysplastic syndrome, leukemias, lymphomas, chemotherapeutic agents, immune suppressants and radiation. They can all suppress bone marrow. Then you can have bone marrow transplant. The bone marrow transplant can also result, or stem cell transplant can result in transient bone marrow suppression. In addition, the chemotherapy used or the graft versus host disease can cause leukopenia. Then infections, viral infections like influenza, HIV, dengue and hepatitis, they can cause production failure. In fact, remember that the infections cause leukopenia in multiple ways. Not only they can cause bone marrow suppression, they can also result in destruction of the WBCs or recruitment of the WBCs into the infected areas, causing neutropenia. So the neutropenia caused by bacterial, viral or fungal infections can be because of multiple reasons. And then certain nutritional deficiencies, they can result in leukopenia like B12 deficiency, folic acid deficiency, copper deficiency. Generally the B12 deficiency or folic acid deficiency does not result in overt increased incidence of infections, but there can be increased likelihood of these people developing infections. And then we have got peripheral destruction or redistribution of the WBCs that can result in leukopenia. For example, autoimmune or inflammatory disorders like autoimmune neutropenia or the sarcoidosis can result in immune destruction of the WBCs, resulting in neutropenia. Then you can certain infections, as I mentioned, infections, they can cause problem in multiple ways. Dengue is a classical example which can result in destruction of the WBCs in the periphery, that can result in neutropenia or leukopenia. Then certain medications, for example, antipsychotic medications or antithyroid drugs, they can result in leukopenia by peripheral destruction. And then finally, the hypersplenism can result in neutropenia. So these are different causes of leukopenia, and most important of these is neutropenia, because neutropenia is caused by many problems, and that can result in decrease in total WBC count. So in patients who got leukopenia, the most often reason is neutropenia. So this is how we proceed in a patient who presents with leukopenia.